Hi, I'm Julia Burrows, the Director of Public Health for Barnsley. This week, Barnsley has been in the news because of its high rates of COVID infection, and there have been suggestions that we might be at risk of lockdown. I hope you've seen the statements that we've put out to explain about this and what's been happening with our rates of infection over the past few months. I know there have been a lot of media reports quoting figures that have caused concern for our communities in Barnsley. Yesterday, we shared a link to the data that contains the rates from all sources of testing, so that includes from hospitals, care homes and from the community, and this has all been now made in the public domain. So it's great that the data is now in the public domain, but I can see that the colours used on one of the key charts in yesterday's release makes it a bit hard to distinguish the lines, so I want to try and make it clearer what this chart is showing. Each line represents one of the 10 places that were in the news this week as being of concern, and we know that Barnsley was one of them. The lines follow the weekly rates of cases per 100,000 people since the end of March. The top line is Leicester, and I put an arrow showing where Barnsley is. Our rate was around 55 cases per 100,000 population 2 weeks ago. Last week it came down to around 35 per 100,000. Currently, one threshold for considering whether to impose further lockdown measures is whether that weekly rate is over 70 cases per 100,000. And for a bit more context, Leicester's rate was over 140. So at less than 35 cases per 100,000 and reducing, you can see that Barnsley is nowhere near that threshold figure, which is reassuring. We are therefore not at any impending risk of lockdown in Barnsley. However, I do want to be frank with you. While it is reassuring that we have seen a steady decrease of new cases reported over the past week, it doesn't change the fact that we still have relatively high rates compared to the rest of the country. We monitor our rates very closely and we are carefully managing every incident and cluster we know about. Although we are quite some way from being considered at risk of lockdown, it's really important to remember that the virus is still here and it will be with us for a long time. We also know that things can change very quickly with this disease, so it's more important than ever that everyone follows the advice to regularly wash your hands, to keep the mid-distance of 2 metres and to stay at home if you have any symptoms. And I really want to encourage everyone to think about wearing a face covering when they're out in enclosed public spaces like shops. We know that that protects other people from getting infected, and we know that it would make a real difference if a large proportion of Barnsley residents did it. And that's all more important now than ever as we head into the weekend where pubs, bars and restaurants are reopening. So please take care everyone and keep well.